Hi, my name is Grace. I'm going to be your nurse today. Today we're going to do a dressing change. I'm going to do some hand hygiene, and then I'm going to make sure we've got the right name and date of birth. And then I'm going to get my equipment. So what we're going to do today is peel off your old dressing, clean your wound, and then put a fresh dressing on. So I'm going to put on some clean gloves.
No,
let's see, and then I'm going to provide some privacy for us, and I'm just going to make sure, are you having any pain right now? If you're having some pain, maybe we would give an analgesic and wait a little bit before we do this. So I'm just going to expose what we've got going on. It's just this thigh wound, and I'm going to keep everything else pretty well covered, and I'm going to peel off this old dressing. Okay, and then I would throw this away. And now I'm going to note the drainage that we've got going on here, anything that would smell or be kind of off color. And I'm going to measure the wound with this disposable ruler. And then I'm also going to measure the depth with a Q-tip. So this wound is, let's see, about 4 1/4 inches long. So then I'm going to toss this, and I'm going to take off my old gloves, and I'm going to perform hand hygiene, and then I'm going to put on sterile gloves now.
Check your wristband here. Great. Are you in any pain today? No? Okay, let me know if you have any pain or discomfort. Provide privacy. Alright, today we're just going to clean and change your dressing. Does that sound okay? Yes? Wonderful. Alright, just going to check for the shoes, make sure they're all straight.
Oh my gosh. Let's see.
I'll put this protected pad.
There we go. There we go. Okay, I got them on. Okay, so now I'm going to open some gauze, some sterile sponges, and I would have a sterile tray, and I would pour in some sterile saline to get these nice and pretty well soaked with the sterile saline. And I'm going to use one piece of gauze for each swipe, and I'm going to clean the wound kind of from top to bottom on each side, and make sure it's all good and clean. And then I'm going to throw these gauzes away, take off my sterile gloves, do hand hygiene, and then I'm going to put on a new pair of sterile gloves, and since we only have one pair, I'm going to use clean gloves.
Hi, my name's Allie. I'll be your nurse today. Can you tell me your name and date of birth?
So I'm gonna do, I'm gonna make sure the wound is dry with some more clean gauze. So I'm just gonna pat the wound dry. Okay, and then let's see, so now I'm going to apply a skin protectant to the area around, and then if there was any medications or packing prescribed, I'd do that at this step. Now I'm going to put on gauze over the wound, and we want to cover the wound with 1 inch on all sides, and then we're going to put on this big ABV pad on the top with the blue line on the outside. And then I'm going to use this adhesive tape to hold it down. Oh my gosh, I really got this. Okay, here we go.
My name is Aaron. I'll be your nurse today. Can I get you to say your name and date of birth? Check your wristband here.
Okay, so then I'm going to take off my gloves. I'm going to do hand hygiene, and then I would label the wound with with my name, or with the date and time that I changed it, because they're gonna change it every shift. And then I would take care of all the supplies, and I think we're all set here.